Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence-based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real-world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students, and that's what I intend to do with this podcast. On today's episode, I have some special guests from my university's undergraduate nursing research and evidence-based practice course. KeyAndra Andrus, Benoit, Gavin Fontenot, Andrea Kelly, and Reilly Leblanc are joining us to discuss their evidence-based practice project. Before they get started with their discussions, I wanted to let our listeners know that I have shared a copy of these students' evidence-based practice poster that accompanies this podcast episode. You can find this resource in the show notes for whatever podcast application you're currently listening to. Now, without further delay, let's turn the show over to KeyAndra to get us started.
Welcome back, listeners. My name is KeyAndra Andrus, and on behalf of my other group members, I'd like to welcome you to our podcast discussing the work we have completed in our undergraduate nursing research and evidence-based practice course. The title of our presentation is The Use of Electronic Cigarettes for Smoking Cessation, and the members of our work group are Benoit, Gavin Fontenot, Andrea Kelly, and Reilly Leblanc. We are all undergraduate nursing students at the McNeese State University in Lake Charles, Louisiana. Go Pokes!
Thank you for introducing your team and your project topic, KeyAndra. The use of electronic cigarettes as a strategy for smoking cessation. That's a topic that continues to spark discussion in both clinical practice and public health in general. To help our listeners understand why your group chose to explore this issue, KeyAndra, can you begin by outlining the problem that your team set out to address, and why do you feel it's important to examine this topic?
Did you know that tobacco use remains the leading cause of preventable death around the world, claiming over 8 million lives every year? It contributes to major health problems like cancer, heart disease, and chronic respiratory conditions. Even with years of public health campaigns, about 1/3 of adults globally still smokes, which shows us just how difficult quitting really is. Our group chose this topic because smoking cessation continues to be a major challenge in healthcare, and we wanted to look at the growing interest in e-cigarettes as a possible alternative to traditional nicotine replacement therapy. E-cigarettes deliver nicotine through vapor instead of smoke and are often promoted as a harm reduction tool. Research, though, is still mixed. There was a study conducted in 2024 that suggested about 1/3 of adults using e-cigarettes remain smoke-free after 6 months. But interestingly, factors like motivational level or nicotine dependence didn't predict who succeeded. This uncertainty makes it essential to keep studying how these methods compare in the long term. For nurses, this topic is incredibly important. We're often on the front lines of patient education and smoking cessation support. Understanding the latest research helps us give patients accurate information about both the benefits as well as the risks of e-cigarettes. It also allows us to create personalized quit plans and advocate for healthier communities. Ultimately, whether a patient chooses e-cigarettes, nicotine patches, or another method, nurses play a vital role in guiding, supporting, and empowering them toward a smoke-free life.
Excellent job, KeyAndra. Thank you for outlining those important issues. Your discussion highlights the significant health burden associated with tobacco use and why finding effective cessation strategies remains a priority. As your group noted, comparing electronic cigarettes with traditional nicotine replacement therapies raises important questions for nurses who provide frontline education and who support individuals trying to quit. To guide your investigation into this topic, your team developed a focused evidence-based practice question. So now, Adam, can you share the EBP question that your group created and how it helped direct your research process?
in adult smokers who want to quit. Does the use of electronic cigarettes compared to traditional nicotine replacement therapy results in higher smoking cessation rates after 6 months? We picked this question because smoking is still one of the biggest public health challenges, and finding the most effective ways to help people quit is really important. Our goal was to see if electronic cigarettes, which deliver nicotine in vape form, actually help. More people quit compared to things like patches or gum. We looked at recent studies and found that some research suggests e-cigarettes may lead to slight higher quit rates at 6 months, but the long-term effects and nicotine dependency risk are still being studied. So while e-cigarettes might be a promising tool, the goal is to quit.
Thanks for sharing your group's PICO question with our listeners, Adam. This question served to focus your group's investigations into the published scientific literature. So can you tell us more about how you used the PICO question to help you find published research studies about your selected topic?
To make sure we got solid, credible information, we searched through a few major databases: JSTOR, the Luther E. Fraser Memorial Library, Embase, and the Crogan Library. Each one had a different mix of studies, so using several really helped us see the bigger picture. When we started our search, we focused on specific keywords. Some of the main ones were electronic cigarettes versus nicotine, smoking cessation and e-cigarettes, vaping, nicotine absorption, and systematic nicotine delivery. We mixed and matched these terms with words like and or to narrow down what we needed. It took a little trial and error, but it helped us get more focused on results. We also used search limiters to keep things current and relevant. We filter out full text, peer reviews, and qualitative studies published between 2020 and 2025. That way, everything we looked at was recent and data-driven. Once we got all the articles, we went through abstract first to see which one really matched our question, comparing e-cigarettes to nicotine replacement therapy, and looked at actual quit rates or nicotine delivery. After narrowing them down, we used those studies to support our evidence in summary and conclusion.
Thank you for walking us through your search strategy, Adam. It sounds like your team used a thoughtful combination of trial and error, strategic limiters, and a focus on the most recent 5 years of literature to ensure that your findings were both relevant and current. That kind of disciplined approach is essential when exploring a topic that continues to evolve as quickly as something like smoking cessation research. So now that the evidence had been collected and reviewed by your group, let's turn to what these studies actually said. Andrea, can you walk us through the key findings that your group members identified through this process?
Following our structured literature review process, we carefully evaluated current research examining e-cigarettes as a tool for smoking cessation. Each group member independently appraised one high-quality study, assessing its methodology, population, and outcomes. We then combined our findings into a synthesis table to better understand emerging trends and the overall strength of the evidence. This approach allowed us to identify consistent themes across the studies and recognize important factors influencing smoking cessation success. Our topic is essentially relevant today as tobacco use continues to be a major public health issue worldwide. Traditional nicotine replacement therapies such as patches and gum have helped many smokers quit, but relapse rates remain high. With the rise of e-cigarettes, researchers and healthcare providers are now exploring whether these devices can serve as effective harm reduction tools. The studies we reviewed provided valuable insights into how e-cigarettes are being used, what predicts success, and how healthcare professionals can best support patients who choose this method. Let's start with the study by Dawkins 2025, which focused on individuals accessing homeless support centers in Great Britain. This population often experiences high smoking rates and faces significant barriers to quitting, including stress, limited healthcare access, and mental health challenges. The study compared the use of e-cigarettes to usual care and found that those provided with e-cigarettes had higher quit rates and reduced tobacco use. This finding demonstrates that e-cigarettes can be accessible, practical intervention for individuals who may not benefit from standard cessation programs. Next, Pope 2024 explored what factors predict successful cessation when using e-cigarettes. Interestingly, they discovered that baseline characteristics such as age, gender, or prior smoking history were not strong indicators of success. This suggests that motivation and consistent support may matter more than demographic differences. Essentially, anyone attempting to quit through e-cigarettes has a fair chance of success when provided with proper resources and encouragement. This finding reinforces the need for inclusive cessation programs that does not exclude individuals based on assumptions about their likelihood of quitting. Walker and colleagues 2023 examined a combination of nicotine salt and salt vapes and cysteine, a plant-based medication that reduces nicotine cravings. Their study proposed that combining these products might address both the physical addiction to nicotine and the behavioral habit of smoking. While research is still emerging, these results point to a potential advantage in multifaceted treatment approaches that combine pharmacologic aids with behavioral counseling. This supports the idea that smoking cessation is most successful when we treat both the body and the mind. The role of healthcare professionals is another key factor, Semagulu 2025 conducted a nationwide survey in Australia examining general practitioners' knowledge, attitudes, and prescribing intentions regarding e-cigarettes. The study found that many providers were uncertain or hesitant about recommending e-cigarettes due to inconsistent evidence and regulatory concerns. However, providers who were more informed and confident in their understanding of the science were more likely to counsel patients effectively. This finding underscores the need for continued professional education and evidence-based training. Nurses and clinicians must stay up to date so they can guide patients using accurate, unbiased information. Lastly, Watson 2021 analyzed the relationship between how often individuals use e-cigarettes and their long-term cessation outcomes. Their research found that consistency is crucial. Those who use e-cigarettes regularly were far more likely to quit smoking completely compared to those who use them occasionally. Consistent use appears to maintain nicotine satisfaction while gradually reducing cravings, helping users avoid relapse. This shows that success not only depends on access to e-cigarettes, but also sustained engagement and follow-up support. In summary, the evidence suggests that e-cigarettes can play an important role in helping individuals quit smoking, especially when used consistently, combined with other therapies and supported by knowledgeable healthcare providers. These findings highlight the importance of individualized, patient-centered care. As nurses and future healthcare professionals, we have responsibility to approach smoking cessation with an open mind and strong evidence base. By understanding the latest research, we can better counsel patients, reduce stigma, and promote harm reduction strategies that meet people where they are.
Andrea, the evidence you presented offers an important look at how e-cigarette interventions may support smoking cessation across diverse groups, including vulnerable populations such as individuals experiencing homelessness. Your highlights regarding the baseline predictors, provider attitudes, and the impact of usage frequency all reinforce how multifaceted cessation efforts truly are. And to your final point, that successful quitting requires attention to both the body and the mind. That speaks directly to the holistic approach that nurses try to bring into patient care every day. So with that evidence in mind, it's important to consider how these insights translate into everyday clinical practice. Gavin, can you share the nursing practice implications that your group identified?
Hi, everyone. I'll be discussing what our group found regarding the implications for nursing practice and for future research. Our project explored how e-cigarettes can be used as a harm reduction strategy for people experiencing homelessness who smoke. Through our review, we discovered that this population faces unique barriers when it comes to quitting, and traditional cessation methods often aren't enough. From a nursing standpoint, one of the key takeaways is that the health profession, and especially nurses, can play a vital role in integrating e-cigarette provision into harm reduction programs. Rather than viewing vaping as simply another habit, it can be approached as a stepping stone towards reducing tobacco use and improving health outcomes. Education is a major part of this approach. Nurses and clinicians can help patients understand how to use e-cigarettes correctly, explain the risks of dual use, meaning continuing to smoke while vaping, and support them in creating realistic plans to taper their nicotine intake over time. This guidance not only promotes safety, but encourages patients to take ownership of their health decisions. In addition, nurses are often the ones who build the closest relationship with these patients, making us well-positioned to monitor for side effects, adherence issues, or other potential relapse triggers. In community clinics, shelters, and public health settings, this kind of consistent, compassionate support can make a real difference. Over our findings, Overall, our findings highlight that nursing practice should embrace a harm reduction perspective, meeting people where they are, offering education without judgment, and focusing on small, achievable steps that move patients towards lasting wellness.
Thank you for outlining those practice considerations, Gavin. Your discussion highlights how e-cigarettes may serve as a harm reduction tool for individuals that face significant barriers to traditional cessation methods, particularly those experiencing homelessness. You also emphasize the nurse's role in providing clear education on device use, avoiding dual-use behaviors, and supporting patients as they move toward gradual nicotine tapering. Just as important is the need for clinicians to approach e-cigarettes with an informed, balanced perspective, rather than viewing them solely as another undesirable habit. Building on those clinical insights, your group also identified areas where additional research investigations are needed. So, Gavin, can you walk us through the research implications that your team highlighted for future studies?
While these implications have potential to shape clinical practice right now, our group also recognized that there are still significant gaps in what we know. The research on e-cigarettes, especially among people who experiencing homelessness, is still very evolving. That's why we understand that the implications for future research is just as important. Looking ahead, there's a clear need for more long-term and in-depth studies on e-cigarette use as part of harm reduction programs. Many of the current studies have short follow-up periods, which makes it difficult to know whether participants maintain smoking cessation over time. Future research should focus more on sustained interventions that track participants for longer periods, helping us better understand the relapse rates, long-term abstinence, and overall health outcomes. Another important finding from our review was that individuals who used e-cigarettes more consistently during treatment were more likely to achieve long-term cessation. That's encouraging, but it also raises new questions such as what specific behaviors, support systems, or program structures help people stay committed to quitting. Exploring those factors could lead to stronger evidence-based recommendations for clinical practice. Finally, research needs to keep pace with changes in vaping technology, especially with the rise of nicotine salt-based products. These newer formulations may deliver nicotine differently, which can impact both dependence and health outcomes. Understanding their long-term effects will be critical for developing safe and effective nursing interventions. In summary, while current evidence supports the potential use of e-cigarettes as a harm reduction tool, more rigorous long-term research is needed to fully understand how best to implement these strategies in real-world nursing and community health settings. Continued research will ensure that nurses can deliver care that's not only compassionate and practical, but also firmly grounded in the evidence.
Okay, so your group has given us a lot of excellent information about the current state of the science surrounding your selected clinical practice topic. Your points highlight how important it is for future studies to look beyond short-term outcomes and examine whether e-cigarette-based interventions can truly support long-lasting cessation, especially among those disadvantaged populations. Extended follow-up on relapse rates, sustained abstinence, and the long-term health effects of nicotine salt vaping will be critical for strengthening the evidence base and guiding nursing clinical practice. Now, to tie all of this together, Reilly, can you now share your group's concluding thoughts? What final insights would you like to leave with our listeners?
After reviewing multiple recent studies, our group found strong evidence that electronic cigarettes are more effective for smoking cessation than traditional nicotine replacement therapies, like patches or gum at the 6-month mark. Across several randomized controlled trials, adults who used e-cigarettes were more likely to quit smoking and stay smoke-free compared to those who used standard NRT products. For example, the SKETCH trial by Dawkins and colleagues in 2025 found that when e-cigarettes were included in structured cessation programs, participants not only had higher quit rates, but also reported smoking fewer cigarettes overall. Another study by Pope and colleagues in 2024 showed that about 1/3 of adults using e-cigarettes were completely abstinent from smoking after just 6 months. And interestingly, their success didn't seem to depend on typical predictors like motivation level or nicotine dependence. When all of this data is combined through systematic reviews and meta-analysis, the trend becomes clear. nicotine e-cigarettes roughly double the likelihood of quitting when paired with behavioral support. That makes a promising, evidence-based alternative for nurses to consider when counseling adults who are ready to quit. Of course, while the short-term and mid-term data is encouraging, there's still a lot to learn about the long-term safety of e-cigarettes and the risk of relapse over time. Continued research will help us understand whether these benefits hold up years down the road. From doing this project, one of the biggest takeaways for me was just how powerful evidence-based practice is in shaping nursing care. By looking directly at the research instead of relying on assumptions, we can make more informed decisions that truly improve patient outcomes. It also reminded me that nursing isn't just about performing skills. It's about critical thinking, evaluation, and advocating for the best evidence to guide our care. In my future nursing career, I can see myself using what I learned here to stay current with emerging research and to have meaningful, evidence-based conversations with patients about their care. So overall, our conclusion is that e-cigarettes appear to be an effective short to mid-term cessation aid, and they represent an evolving area of practice that nurses should continue to watch closely as more research becomes available.
Thank you for summarizing your group's conclusions so clearly, Reilly. The evidence you reviewed suggests that electronic cigarettes may offer higher 6-month cessation rates than traditional nicotine replacement therapies, positioning them as a potentially valuable option for nurses to consider when counseling adult smokers. Your takeaway, that evidence-based practice empowers nurses to move beyond assumptions and ground their care in current research. That's an essential lesson. Nursing is not only about hands-on skills, as you said. It is also about staying informed, interpreting emerging evidence, and guiding patients with the most accurate information we have available to us. To our listeners, thank you so much for joining us for this discussion. Topics like smoking cessation continue to evolve rapidly, and engaging with the evidence helps all of us deliver safer, more effective care. We hope you'll continue exploring topics like this on future episodes of Nursing Research Tips.